Hi everyone, my name is Alexis Basden, and today I'm going to be discussing the mental health challenges faced by nurses. How many of you know someone who is a nurse or have come in contact with a nurse at some point in your life? All of you, right? Nurses are always praised for the physical demand the job requires, the compassion they provide to their patients, and their education. But what if I asked how many of you know about the mental health challenges that are affecting nurses worldwide? Not many, right? What nurses are rarely asked is the simple question, how are you? Nurses are the men and women at the front lines of healthcare. They spend the majority of their time caring for their patients that they forget how to care for themselves. Some of the challenges that I will be discussing today are physical and emotional stress, burnout, and anxiety and depression. In order to understand why nurses struggle, it is essential to understand the cause. Nurses face stressors every day while at work. Emotional stress comes from the emotional demand. Nurses not only consider patient emotions, but also family members, physicians, co-workers, etc. Working in a high-intensity environment, emotions always run high. Another stressor is the responsibility that a nurse has. Nurses are involved in direct patient care, and safety is always a number one priority. We administer treatments and medications that require meticulous execution to keep our patients safe. Nurses are also the voice for a patient or a patient advocate, especially whenever they do not have their own. Another stress is the physical demand of the job. Nurses work long hours with little to no downtime. They have poor sleep schedules, poor eating habits. Nurses do heavy lifting, pushing, and pulling while just trying to provide basic patient care. Since nurses face such high stress levels, burnout is common among the profession. Since the COVID-19 pandemic, nursing burnout rates are at an all-time high. The high mortality rates, the little to no understanding of the disease, the panic derived from fear of not knowing how to treat patients. In nursing school, the first thing somebody tells you is if this happens, this is how you treat it. There was nothing like that whenever COVID came around. This led to 64.3% of nurses reporting burnout. Nurses were traumatized by the death of their patients, and COVID-19 was the third leading cause of death in 2021. This led to nursing shortages, an increase in patient load, and less resources. 36.5% reported their intent to leave the bedside after the pandemic. Nurses also have a poor work-life balance. They have low energy levels for extracurricular activities, such as seeing their family, their friends, doing things they enjoy, like traveling and working out. Nursing is also high in divorce rates. It is among the top 10 professions with the highest divorce rates. Finally, all of these challenges lead to struggles with anxiety and depression. Nurses have constant exposure to death and dying. It leads to feelings of guilt and self-doubt. Nurses are constantly in high-stakes and life and death situations. This causes them to live in a fight or flight mode, which can increase your anxiety level. Anxiety is also increased by not wanting to make a mistake. Like I said, patient safety always comes first. All in all, nurses face a great deal of challenges, not only in their professional lives, but also their personal lives. In conclusion, the mental health challenges nurses face are oftentimes overlooked. It is crucial to understand that even nurses struggle sometimes too. I hope I could shed light today on the side of nursing that is rarely talked about. Providing support or just a simple, how are you, can make a difference. Thank you for listening.